Next, we can talk about polysan K. Polysan K is related to circulation, also related to hypertension, allergies, rheumatism, congestion, virus, and bacteria. Very much so related to the condition of the circulatory system. And finally, we come to polysan M, which is related to malaria. Liver problems, hormone problems, metabolic problems, etc. Regarding polysan A, D, or DX, and also OM and G, we don't see a positive reaction. The blood doesn't seem to create a sort of a agglutination reaction in these positions. Only regarding polysan E, T, R, M, and K, we can clearly see an agglutination reaction, which means a positive reaction. Thank you for your attention, and I'll see you on my next video.